This show is introduced to you by Global Healthy Living Foundation. The Global Healthy Living Foundation is a non-profit working to improve the quality of life for people living with chronic conditions through advocacy, education, and patient-centred research. We wish to acknowledge the Dukandjung people as traditional custodians of the land on which I live and work. I pay respects to the elders past, present, and future. Welcome to A Matter of Vax. I'm your host, Steph O'Connell. I'm a health advocate and a health communicator with a career in public health and public affairs. Professor Robert Boy is an infectious diseases paediatrician. Since 2005, he's worked at the University of Sydney in the fields of vaccinology, epidemiology and infectious diseases. He's a professor of paediatrics and child health and a senior professorial fellow at the National Centre for Immunisation Research and Surveillance at Westmead Children's Hospital. Robert, when I think about how extraordinary our times are right now, I look at the big picture and I kind of wonder, how important has the last 2 years been to our public health history?
Well, that will only be certain in the course of time will we understand that. I think right now it's very clear that people suddenly realise that public health is important. They understand concepts that they'd never even heard of before, and they understand that vaccines are highly preventative but not perfect. They understand that there are other measures of controlling health and preventing disease, masks, hand washing, things that we weren't used to doing as a routine. Of course, we do hand washing when we go to the bathroom before we prepare a meal, but hand washing on a more regular basis. The whole idea of checking in so that we can do contact tracing is something we weren't familiar with before. So there's so much that's changed, and I see change as the norm. What we have now is just another state of flux, another movement towards a different state of being. We have learned so much about how to protect ourselves and particularly how to protect our loved ones. But we're going to go on learning and we're going to go on improving and we're going to go on taking into account other social and domestic and societal and political and environmental measures. I think we've got to a point where people are thinking much more deeply about life in general.
It seems to me, listening to you, that everything old is new again. The images of people running indoors away from plagues and pandemics of the past, that's a legitimate tool that we're all now very, very familiar with. Do you think it's going to change the way that we are in future and the way that we as a community approach disease?
Well, there's no doubt that things have changed dramatically. And then again, 100 years ago, we did all sorts of things that we're doing right now. We had a great influenza pandemic that killed 50 million people worldwide. So far, COVID has killed 5 million, but the true number is nearer 15 million. We have changed. We know how to wear a mask now. We wore one 100 years ago, and it worked moderately well. But now we know that there's N95 and then N99 or 100. What does that mean? 100% perfect filtration. So a virus can't get to you. And 99 means 99 times out of 100 it can't get to you, so to speak. So we've learned how to use a mask. We've learned how to interact socially. We limit the number of people coming to our home. We look at our own homes individually and inside the home and say, if you potentially are infectious, you use this part of the home, this bathroom, this food preparation area. So we're just so much more nuanced. We're so much more thoughtful. We're so much more informed by science and practical notions that people now, were they to catch COVID, are very unlikely to die from it unless they're an at-risk person. So those at-risk people are the ones we've been desperately trying to vaccinate as quickly as possible. People over 65, people with chronic medical conditions, their heart, their lungs, the liver, the kidneys. So COVID has taught us so very much. It remains a major threat. It even could be a further threat in 2022, what with further mutation. It's an RNA virus. It knows how to change its spots. It knows how to mutate. It knows how to become more transmissible. Whether in changing and evolving and becoming a more transmissible virus that will become more deadly, well, that's a big question and probably unlikely. But there you go. There's so much that's happening. There's so much we're doing, and there's so much challenges ahead of us with COVID.
You've been a strong and passionate advocate for vaccination for 30 years and incredibly well qualified on the subject, and now a national voice. You're offering us hope, not just the facts. What's it been like for you as a professional?
Well, for me, it's actually been very tiring. because I hardly take a day off, and on a daily basis, new information is coming through. And I have a phone which feeds me emails and text messages, news reports, and all sorts of different quality information. So for me, it's been hard work that I've been really glad to do, work that I'd had more than 30 years preparation for by way of studying infectious diseases since the 80s. Indeed, I studied HIV/AIDS 40 years ago when it first came out, and I was worried and intrigued by it, and I thought, I need to do something about this. And one of my best teachers, Professor Richard Kemp, was an infectious disease specialist, and he later offered me a job at the Royal Brisbane Hospital. He really researched and he really understood the problem, and he could teach it, and he made infectious diseases into something that was important and something that I really wanted to investigate and dedicate my life to. So in the 1980s, working under a teacher like that, I got inspired. And one of the sad things was that he himself ended up dying of AIDS. So that inspired me more. So for a long time now, I've seen deadly, life-threatening infectious diseases. I've seen paths to their better treatment, to their prevention. But we still don't have a vaccine for HIV/AIDS after 40 years. So there are so many challenges ahead of us. We've done incredibly well to develop vaccines within months against COVID, and so many different types of safe and effective vaccines.
We've had real success with the National Immunisation Program, haven't we? HPV, chickenpox, Hep A and B have all seen a reduction because of it. I wonder if you could tell us a little bit about the National Immunisation Plan, its importance, and why every Australian needs to be more aware of it.
Well, the national plan, the National Immunisation Plan, the NIP, came into being at the end of the 90s under the 7-point plan introduced by the Health Minister, Michael Woolridge. It was prophetic almost approach. It was practical. It was effective. It said, let's get a national centre going where we can coordinate the understanding and the support of vaccination, and let's really put time and effort into helping GPs and nurses to deliver appropriate vaccines, and let's deliver more and better vaccines as time goes on. We introduced vaccines against chickenpox, and on it went. So many new or old diseases had a vaccine introduced which was safe and effective. The National Immunisation Program has, during the last 10 years, achieved at least 95% vaccination uptake rates of children of almost all vaccines available. An enormous achievement and equivalent to the best in the world. It means that these diseases are gone and some of them are forgotten.
Robert, 3 years ago, the National Immunisation Strategy for Australia 2019 to 2024, the authors wrote that because some diseases are no longer visible, our communities face a risk of complacency that could have an impact on Australia's vaccination coverage. Is that still true? And has COVID-19 eased or confirmed